I'd like to introduce our first speaker, who is coming to us via video from Washington, and that's Senator Kirsten Gillibrand. And Senator Gillibrand was elected in 2009. She is a native of the Capital Region, and you may be familiar with her work on Veterans Affairs, but of late, she has begun to work actively as a member of the federal Senate Select Committee on Aging. And as part of that committee, she has a number of initiatives, and we'd like to hear her now. So Bruce, if you could play the video.
Hello everyone, I'm Senator Kirsten Gillibrand, and I'm delighted to welcome you to the second day of the 26th Annual Elder Law Forum. I want to thank Lou Piero and everyone at Piero, Connor and Strauss for hosting this important event and for your years of work in elder law. As we work to recover and rebuild from this pandemic, we must build better systems that provide health equity for people of all ages. For older adults, that means ensuring long-term care options are accessible and affordable so that people can make choices based on what is best for them and their families, and not just based on what they can afford. That has been one of my top priorities in my work during our recovery and throughout my time on the Special Committee on Aging. I worked with Senator Casey to fight for COVID relief provisions that secured billions of dollars for states to enhance and expand home and community-based services and to support care workers and family caregivers. I also secured $1.4 billion for Older Americans Act programs that deliver essential meals and social services to adults and people with disabilities. And I will fight to make sure that the American Jobs Plan makes the $400 billion investment in senior and long-term care that President Biden has proposed. All of those resources will help more of our older adults live where they want to, at home or with family. But we need to keep building on this momentum. I'm excited to be working with my colleagues on a bill to do just that, the Home and Community-Based Services Access Act. That legislation will help us eliminate the wait lists for those services, cover rehabilitation and other services, and provide better support to both paid and unpaid caregivers. It will also take the pressure off of state budgets so that home and community-based care services aren't cut as states try to recover from the pandemic. We know that continuity of care is critical. That's why I work to include a provision in the CARES Act that allows Medicaid to pay direct service providers to accompany their patients during hospital stays. And that's why I want to ensure that we provide our care workers with the support, equipment, and security they need to stay on the job. I called on HHS to provide them with PPE during the height of the pandemic. And I will be leading the Domestic Workers Bill of Rights, which will recognize the importance of that work and provide care workers with the federal labor and civil rights protections they deserve. For many older adults, long-term care also means managing chronic conditions that require costly prescription medication. Nearly 9 in 10 older adults takes prescription medications, and 1 in 4 say it is difficult to afford them. I have spent the last few weeks visiting cities across New York to talk with older adults about the need to reduce prescription drug costs. And I support legislation that would allow Medicare to negotiate drug prices, a change that could save the government more than $450 billion over 10 years. That's money we could use to expand access to long-term care and other health services. As we look to the future, we must continue to consider new ways to improve our financing of long-term care across the board, from Medicare and Medicaid to public-private financing and long-term care insurance. And we need to find ways to use new tools at our disposal. I want to look at ways innovation and technology can reduce long-term care costs while improving quality of care, patient experience, and patient outcomes. I know that there are going to be a lot of great discussions about the future of long-term care today, and I can't wait to hear what comes out of them. You can count on me as a partner in this work, and know that I will continue to champion our shared priorities in Washington. Thanks to you all, and enjoy the rest of the forum.
We want to thank Senator Gillibrand for those words of encouragement. The issue of long-term care has not been as hot in political circles since 1965, when Medicare and Medicaid were enacted. $400 billion is part of the infrastructure bill for home and community-based services. As the senator mentioned, 1.4 billion has come to New York, and you may hear Greg Olson talk a bit about that, for services to seniors to keep them independent, keep them at home. And we laud that work of the Senate Aging Committee and Senator Gillibrand's work on that committee, and we look forward to working in collaboration with the committee and Senator Gillibrand going forward.